Children have returned to school in Russia amid growing concern among teachers and parents as the country's coronavirus cases topped the 1 million mark.
Russia's coronavirus case tally passed the 1 million mark on Tuesday as schools and education institutions reopened across the world's largest country with new mandatory safety precautions in place. Russia has the fourth highest case tally in the world after the United States, Brazil, and India, which has been tracking the virus since it was discovered. But officials say more than 800,000 people have recovered from the disease, and that with just over 17,000 deaths, the death toll is lower than in many other European countries. The Coronavirus Crisis Center said on Tuesday that the overall case tally stood at 1,048,000 after 4,729 new infections were reported. President Vladimir Putin, in a nationwide TV address, told school children and students to observe virus safety rules. It's mandatory for teachers to wear masks in schools in Moscow, which has been harder hit by the virus than other parts of Russia. Teachers are allowed to take off their masks in classrooms when teaching, however, provided they keep a safe distance from children.
В конце прошлого года обучение было дистанционное. Сейчас обучение начинается очно, и очень приятно встретиться со всеми друзьями. Ковида я, конечно, не боюсь, но все равно меры безопасности все соблюдаю.
Moscow's school children are not required to wear masks in schools, but traditional ceremonies at the start of the school year were canceled on Tuesday, and the use of different classrooms will be limited to reduce infection risks.
And to discuss the current situation regarding COVID-19 and coronavirus, I'm joined by Dr. Bharat Pankhania, who's a senior clinical lecturer at the University of Exeter Medical School and with 20 years in communicable disease control and infectious disease management. Dr. Pankhania, thank you very much for joining us on aNews. Can I ask you, there's so much to talk about for coronavirus. It's difficult to know where to start, where to finish. So I'll just ask you very simply, which is the biggest issue, prevention or cure?
Oh, we've got to prevent it, without a doubt, and emphatically so, because at the moment we have no cure. And because we have no cure, all we can do, the only thing we can do is prevent it. And what we've got to do is, because we cannot prevent it across the board for all human beings, identify the human beings who are at risk, give them special measures and protect them and keep them alive until we find out a solution to how we can treat it. So until a vaccine becomes available or a medicine becomes available, or we have better technologies in keeping people free from severe illness, the only solution is prevention.
Okay, and that opens up a whole new load of different paths we can follow. So in terms of prevention, obviously many countries in the last months have been through periods of lockdown which have had undoubted success, but now so many of those lockdowns are being given up. Is this a bad mistake, or what should countries actually be doing now to prevent the further spread?
So before I go into that, the salutary lesson to have learnt here is, if you act fast, if you act early, and if you act hard and fast very early on, you regain control. So this is very much like a forest fire. If you act fast, act hard, act very quickly, you regain control, then you can return back to normal economic activities like New Zealand. The trouble is, we've got the economic pressures and then the healthcare problems. And what politicians are trying to do is a balancing act of keeping the economy going so that people don't die of poverty, which is very important too. And at the same time, telling us to start economic activity, but be careful. But because it is not absolute protection, we will get case numbers go up. So what we have to do is understand the transmission of this virus, how it behaves, how it infects, how it makes people ill, and then take those measures despite being in full economic activity and traveling on buses, trains, transport, going to the office, etc., we take all necessary precautions. And at the same time, if we know that somebody is at high risk of dying because they got the infection, we give them extraordinary precautions. And for some people, we will have to say to them, stay at home.
Right. And this is where contact tracing comes in as well, is it not?
Absolutely. So if you can identify the case very, very quickly, and then identify the contacts immediately, as quickly as possible, then what you can do is pull the case out of circulation, pull the contacts out of circulation, and keep a lid on it. In other words, you're fighting this fire and keeping control over it. But if you are not managing to do your testing, then you don't know where your case is. And if you don't know where your case is, you're not doing the contact tracing, and therefore you're losing control. So yes, you're absolutely right. You need a really good system of testing and testing extensively so that you can find the contacts, and then you pull both the case and the contacts out of circulation. This is a very important thing to do.
Now, one of the problems in all of this, of course, is the political aspect, and that even contact tracing has become political in some parts of the world, and also the urgency to find a virus has become, a vaccine has become very political. What's your take on how we're progressing towards a vaccine? Do you believe that it's possible one will become available in the not too distant future? And if it does come, would it bring an end to the coronavirus pandemic?
Very important issues. So with respect to vaccines, I don't think we've got anything viable, proven, possible in 2020. I don't think so. So what we've got to do is, with regard to the vaccines, is aim for the long term. And even in the long term, there is not an absolute 100% guarantee that a vaccine will save ourselves. If you really want to ask me the difficult question, the question is, why did this virus arise? What we can do is look at the emergence of new viruses and do the preventative work there. And you prevent it. So that work we are lazy about because it's not sexy enough. But if you spend millions in stopping the emergence of new viruses, then you will save planet Earth by not spending trillions and trillions and trillions of pounds and having lockdowns and all those things. So really, the main investment should be in looking at the emergence of new viruses, do the work there, and prevent them from arising in the first instance. In which case, you would never hear from me, because I would be doing the backroom work and nobody would ever know that we did all this work of preventing the emergence of new viruses.
Well, we're very happy to be able to talk to you right now. So, but of course, even that solution to prevent the emergence of new viruses, even that has a political spin to it, does it not? Because that talks about the responsible management of the world and being responsible custodians for the world that we live in. So is that a realistic ambition? We've
got no choice. If you do not want to listen to this serious pandemic that we've had, COVID-19, and you want to carry on misbehaving, there are worse viruses to come. So this is a good wake-up call for planet Earth, that under the aegis of bodies like WHO and others, if WHO is not good enough, make it good enough. Right. And you've got to have what I would call mutual responsibility. I am responsible, you're responsible, our community is responsible, our country is responsible, our region, our nation, our planet Earth. And we've got to work together, because if we don't do it, there are worse viruses and there are antibiotic resistance things coming, so many other things happening. This is the time to say we will work together. It is important that we do. We need good, strong, honest political leaders.
Indeed, and not just to fight against illnesses, of course. Now, coming back to the pandemic as it is today, we're seeing a new academic year is beginning, and different countries have responded to that new academic year in different ways. Here in Turkey, for example, schools have begun with online learning, with a hope that when conditions can be made safe, that either in groups or whatever, that pupils will begin to have some form of school attendance later this year. What do you feel about schools reopening, as they have done in many other countries?
I'm very pleased to hear what I have just heard. That is, the government of Turkey has taken the step to say, we are going to enable distance learning for you at home. And that is a very good way forward, because inevitably, this is the way to sort of have a new approach to old problems, which is, if you can't go to the classroom, it doesn't mean you shut the classroom. You've now got the internet, you've got computers. Why not teach you from home? It is a good way forward. With respect to schools opening, inevitably, case numbers will go up. The children, the young adults, in most cases, get infected, get better. But my concerns are that the young adults, the young teenagers, who may get the infection at school or colleges, will bring it home to their older parents or grandparents. Therefore, for the next 3 months, I'm very concerned, and I'll be watching anxiously to see if the case numbers go up because the schools have opened. I hope not, but I'm not very optimistic. So we've got to be watchful about schools, because it is an uncontrolled environment. And my view is, in the United Kingdom, private schools have been leaping forward, teaching their private fee-paying students at home through lessons and lectures delivered by their teachers through Zoom or Skype or Microsoft Teams or other medium. And I think that is a good investment to make, and we should all make those investments. I'm very pleased to hear that Turkey is doing this. It will do you good.
Indeed. In fact, it's pushing boundaries, and my son was studying with his classmates through the computer today, so it's opening new avenues of creativity. Yeah. Obviously, the coronavirus has changed our lives in many other ways than the way that we do things. So, and there's both positive and negative effects. With one positive, we just described how technology is being used to benefit people in new ways. But just finally, can I ask you about the mental health impacts of this pandemic? What do you think? Obviously, this is, even if the pandemic all countries were to return to zero tomorrow, the after effects of the pandemic will continue. What are the long-term mental health issues here?
Very serious, very important, and we must not disregard it. A lot of human beings suffer from poor mental health at some stage in their lives. And with regard to this isolation, lockdown, restriction of movements, and loss of jobs, loss of livelihoods, I expect big problems with mental health. And I'm very sad, because mental health equals poor life expectancies, poor life experiences, and a lot of consequences. So governments need to be awake and alert to the fact that we are going to get mental health problems. Invest in it now and be prepared for a lot of mental health. The other thing is, and I understand Turkish people very well, I am an Indian, and Indians and Turkish people are very similar. They don't talk about mental health. Mental health is something you don't want to mention. And I would urge people, it is important to say, I feel depressed, I feel anxious, I feel worried, and be open about it. That opens the door to sort of being allowed to talk to others and do something about it and get support. So we need to brace ourselves and look after our neighbors, our friends, our brothers and sisters, and be aware they might have mental health issues as a result of coronavirus. And let us do all our bit, but governments have to do a lot more.
So obviously there'll be lots of work to be done to wrap this up, and lots of work to do to encourage people when a virus, if and when a virus does finally become available, to an antidote vaccine become available, to encourage them to take that. Well, thank you very much, Dr. Pankhania, for joining us this evening for your insight on the coronavirus pandemic.
Thank you. Thank you very much.
Thank you.